A very warm welcome to everyone. We're glad you could join us this evening. We are HART Fertility Clinic, Cape Town. We're based in the world-renowned Christian Barnard Hospital, and we feel so privileged to be part of such a state-of-the-art facility. So having gone through a very difficult year for all of us already, many of our patients have had their fertility treatment plans curtailed. So we thought this would be a great time for us to look at ways that patients can deal with the stress and also prepare themselves emotionally and physically for the new treatment opportunities that will present themselves in the coming months. To that end, we have Mike from the Berkley Center for Reproductive Wellness and Tara from YogaMama joining us to talk about the role of acupuncture and yoga in fertility treatment. Please post your questions in the comments. We've already had a lot of questions coming through our WhatsApp and DMs. But Mike, please tell us about yourself and the work you do.
So since I'm in New York, I'll say good morning. But since you're in SA, I'll say good evening. It's lovely to be here, and thank you for having me. So I'm Mike Berkley. I'm a licensed and board certified acupuncturist. I'm a board certified herbalist. I'm the first acupuncturist in the United States to specialize in the treatment of infertility. I've been doing that strictly and solely for 23 years. I work hand in hand with many of New York City's most renowned reproductive endocrinologists, and we share patients very frequently. So my job is to try to improve egg, sperm, or lining, and their job is to do retrievals and transfers. And I think that East meets Western reproductive medicine is the new gold standard.
Tara?
Hi, I'm Tara, and I'm the owner of YogaMama. Also very happy to be here, and so glad that HART Fertility has this contribution to holistic fertility, that not only do they do medicine, but they understand that emotional fitness and physical fitness is also important in your journey to fertility. So I do fertility yoga, prenatal, postnatal, mom and baby yoga. I'm also a life and parenting coach who will assist you in getting emotionally ready for conception, dealing with the ups and downs of maybe something going wrong or having to redo it, experiencing losses and all of that, getting yourself emotionally more in line and just feeling from an physical, spiritual, and emotional level that you are ready to have your baby. And in the pregnancy process, also assisting mothers and fathers to get into the understanding that life is about to change, for the better, but also helping them understand that there is a transformation from just normal woman to mother, and that's what I'm there to assist in.
Great. So Mike, what is acupuncture and what's its role in fertility?
Well, acupuncture is a 2,500-year-old form of medicine that was originated in China, where stainless steel, completely sterile needles are inserted into certain points along the body. And acupuncture can be used for many different reasons, from treating back pain and headaches to treating fertility cases. So my life is all about fertility. So in my hands, acupuncture is meant to improve and increase hemodynamics, blood flow, to the ovaries and follicles and testicles and uterine lining, because blood is simply a messenger. Blood carries the FSH and the LH from here all the way down here. When we eat food, why do we eat food? Because we think it's delicious. No, we eat food because we need nutrient products. How do nutrients get distributed throughout the body? Via the blood. So acupuncture improves the delivery of oxygen, hormones, nutrients, and electrolytes to these various locations of reproductive importance. In addition to delivering the good stuff, it also helps to more rapidly excrete debris, dead cells. So acupuncture's endpoint is to improve egg quality or sperm quality or lining quality. Additionally, we treat patients for 13 weeks after they're pregnant to help mitigate two things. Two different terms mean the same thing: IUFG and IUGR, intrauterine fetal demise and intrauterine growth retardation. These happen because there's not enough blood flow to the developing placenta. Acupuncture solves that problem.
Okay. All right. And what can one expect from an acupuncture session?
Well, if the patient is a new patient, the session's an hour and a half. There's about 45 minutes to an hour of intake and evaluation, which consists of asking multitudinous questions about every possible physical and emotional aspect of the woman, or the man. We also take in the Western medical findings, the day 3 hormones, TSH, progesterone, et cetera, autoimmune disorders, natural killer cells. We ask many, many questions, and upon that we arrive at a differential diagnosis. Then the patient goes and lies down on the table, and depending upon what pathology is in front of me, that will dictate or mandate the specific acupuncture protocol to be used on that particular patient.
Okay. Is it painful?
Absolutely not. Acupuncture needles are stainless steel, and they're about as thick as 3 or 4 hairs pulled out of your head. So they're very, very thin, completely sterile, completely safe, used once and disposed of, absolutely no pain.
Okay, so even if you're afraid of needles, you'll be quite fine with acupuncture needles.
Well, not only will they be fine with needles, but they have to be fine with the practitioner. So let me give you a quick example. If I get a patient who says, I'm deathly terrified of needles, but I really want to get acupuncture, what I say to the patient is the following: you're in control. I'm going to put only one needle in you. Just one. You have to realize my protocol consists of 16 to 20 needles. So I say, I'm just going to put one needle in you. If it's okay, I'll put another one in. If it's ever not okay, we'll stop. So I always make sure the patient is in control,
yes,
which gives the patient confidence, and they can exhale and they can relax. But in answer to your question at the beginning, acupuncture is painless.
Great. That's good to know. So Tara, you've said before that starting yoga when you begin your conception journey is a wonderful time to go inward and to really turn attention to your soul. How does this work?
So what yoga does is yoga is an experience, a body, soul, and mind experience, where you come to a class, and how I start my classes is we discuss how you are, where you at, how are you. So that's where the coaching interlinks with yoga, is we talk about how you are, how you're feeling, and then we go on to do body movements that then also encourage blood flow in your body. It also helps your body feel physically well. And then we use meditation, which then calms your mind and just brings you to a point of focus, calming the thoughts that go through your head. As you know, when you go through a fertility journey, you always feel like, I doubt this will work. Will this even happen? I've been doing it 4 times and nothing has happened. So your mind tends to be your own dark enemy, in terms of your fertility journey, and enjoying the process instead of making it a activity, to do. So yoga really just helps you relax into your body, feel into your body, move into your body, and also experience meditation and breathing exercises, which regulates your mind.
Okay. Are there specific fertility issues like PCOS or endometriosis and others that fertility yoga can assist with?
Yes, definitely. So it assists with those conditions and also a lot of others, because you tend to move and the pain can decrease when you move your body. Also, the breathing allows you to get the blood moving efficiently throughout your body, which then also helps you manage pain better. And it's not a medical cure for obviously PCOS and endometriosis, but it does ease up your symptoms.
Okay. And how often should yoga be practiced?
It should be practiced about maybe 2 or 3 times a week, I would say, because that's when you'll see the best results from a continuous practice. There are people that practice it daily. Meditation daily is also encouraged, even if you don't do it with a practitioner, but with a, maybe a video or a sound clip or something, just to get yourself in that space where you can actually sit in silence. Strangely enough, people can't sit in silence because your mind again rushes, and it just tells a different story when you sit in silence. So then you tend to not want to sit in silence. So people sometimes manage 2 minutes. So doing it a daily practice really allows you to, understand and do it 2 minutes today, 3 minutes tomorrow, maybe 5 minutes the next day. And that's how you increase your ability to actually last maybe for like 20 or 30 minutes at a time. I do recommend for fertility that we do it at least 2 to 3 times a week.
2 to 3 times a week.
Yoga and meditation.
Okay. And what about acupuncture, Mike? How many sessions do you recommend before starting, say, my fertility medications?
So that's a complicated question that sounds like an easy question. So it takes gametes, which are sperm and egg, about 120 days to go from immature to viable. To use medical language, we'll say a primordial follicle, which is measured in micrometers. It's very, very tiny. A mature follicle is about 20 millimeters. So the journey from primordial follicle to mature follicle, also known as a Graafian follicle, takes about 90 to 120 days. So I like to treat for 3 to 4 months in advance of the retrieval. However, it doesn't always work like that. Patients will call me and say, I'm doing a transfer next week and I want to come in for acupuncture. Will it help? And my answer to them is, no, it won't. But you should start getting acupuncture anyway. And then they'll say, I don't understand. You sound contradictory. And I'll say, well, it does sound contradictory, but it's not. Here's why. Start now, even though you're doing a transfer next week. If you become pregnant with the transfer, we're going to continue to treat you twice a week for 13 weeks to help mitigate miscarriage.
Okay.
If the transfer fails, we've already started working on the egg quality, and we'll just continue to treat you until you're pregnant. And then after you're pregnant, we'll continue to treat you for 13 weeks. So in fact, the best time to start is right now, no matter where you are in your cycle.
Okay. But generally speaking, at least 120 days before your treatment cycle.
That's the best case scenario.
Okay. And once it sounds like the first session is the longest session. How long, because of the medical history intake, how long are the other follow-up sessions?
The patient is always on the table for only 20 minutes. Now, there are different acupuncturists that do different things, just like there are different reproductive endocrinologists that do different things. Some acupuncturists keep their patients on the table for 45 minutes. Some keep them for a half an hour. Some keep them for an hour. It seems, based on my experience, that 20 minutes is a clinical period of time, or it's a period of time that will yield clinical benefit. And so they're on the table for 20 minutes, and that's it, in and out.
Okay.
And I treat them twice a week. Many acupuncturists treat their patients once a week, which is a big mistake if you think about it. Tara was talking about doing yoga 2 to 3 times a week. Of course. Are you going to go to the gym once a week? Most people go to the gym 2 to 4 times a week. If you have a car accident, God forbid, and your shoulder, you have frozen shoulder, you're going to be in physical therapy 5 times a week. So acupuncture is a cumulative process. It takes time and continuity for it to be effective. So I like to treat twice a week.
Okay. Let's get to some of the audience questions. We have a question that's come through via WhatsApp. What are the benefits of doing yoga when you're trying to fall pregnant, and how does it affect the body?
So when you're trying to fall pregnant, you are bringing in a soul into your body. So basically what yoga does, it aligns your body, mind, and soul to be whole completely for you to conceive the baby. Getting your mind also prepared that, okay, my body's going to change, things are going to happen. Am I really prepared for this baby? I've seen a lot of moms that come for fertility yoga that say we're trying to conceive and we're starting this fertility journey. And maybe 2 or 3 sessions in, they realize that I feel like I'm not ready. And that may be the reason why they haven't conceived yet, because mentally they're blocking it because they're not ready for this. Sometimes it's, pressure from maybe the partner, maybe it's pressure from family, many other reasons why. But it just helps you realize in your body what it is that you need for this pregnancy, for your body to be prepared. That's in terms of emotional, physical. It helps you get in a condition where your body is strong. Our body takes on a lot when we become pregnant. You have to carry a 3 kg baby, you're carrying a 2 kg placenta, you have 2 extra liters of blood in your body. So all of that needs a body that is sustainable. So I find that if you start yoga before pregnancy, you tend to get into a better shape, and your pregnancy is actually a lot smoother. The aches and pains get less because you continue yoga with me from before pregnancy. So fertility yoga, you move on to prenatal yoga, where we deal with the aches and pains that then arise from that. But in terms of what I've seen with my patients is the ones who started at fertility and gone through to prenatal yoga have a lot less symptoms, they've got a lot less pains and discomfort during their pregnancy.
Wow, okay. Another question here for Mike. How can men benefit from acupuncture?
So there are various types of sperm anomalies. Some of them can be helped by acupuncture and some of them cannot. So physical barriers to sperm production or ejaculation cannot be helped by acupuncture. Genetic abnormalities cannot be helped by acupuncture. So if a man has microdeletion of the Y chromosome, he has no sperm, acupuncture cannot do anything for him. If he has congenital bilateral absence of the vas deferens, acupuncture can do nothing for him. But there are many men, that's just line out of a 50 Cent song. There are many men that have sperm problems that are functional. So for example, there is no inappropriate anatomy of the testicles. Everything is fine. The hormones are fine. But they either have low count, poor morphology, poor motility, or a hidden pathology known as sperm DNA fragmentation. And so acupuncture, by increasing blood flow to the testes and by reducing stress, amazingly and very frequently improves sperm parameters. If you were to say to me, what is the mechanism of action? I would say I'm not really quite sure. But I can only tell you that through many years of experience and treating, I've seen fantastic results. One thing, this hidden pathology of sperm DNA fragmentation, I'm not going to give you a 2-hour lecture on it, but basically if sperm DNA fragmentation is above 29%, there's no pregnancy that's ever going to happen. Won't happen. Possible to happen. So I've had many men with high sperm DNA fragmentation levels and brought them down, not even necessarily to normal levels, but to better levels, and sometimes to normal levels. So in certain instances, acupuncture is very effective in improving sperm parameters.
Okay. Do you find that men are open to coming to see you for acupuncture?
Mostly not.
Why is that?
Well, there's the excuse, and then there's the reality behind the excuse.
Mm.
The excuse is, I'm too busy. I can't come in twice a week. That's the excuse. Let me put something to you for your consideration. If a man was diagnosed with cancer and he had to go to the doctor 4 times a week, he'd go.
Yes.
So I'm too busy. But what's behind it, I'm too busy, is one of two things. I don't believe in acupuncture. I think it's a bunch of nonsense. I don't want to waste my time and money. Or they don't want to even deal with or face the fact that they have sperm anomalies, because sperm in certain cultures, certainly in the American culture, is associated with manhood and masculinity. And if you have a problem, and what?
Virility.
And virility. And so if you have a sperm anomaly, you're less than.
Mm.
And so men don't want to deal with this on a psycho-emotional level. So I think I do have some male patients, but very few. 97%, 98% of my practice is female factor infertility.
So what do you have to say to the guys that don't want to come in?
I don't say much.
Probably because you don't see them.
No, that's another line from a rap song by Beanie Siegel. I don't do much. You can see I'm a rap fan.
I see.
I don't say much. This is what I say. I'm talking to the wife, and listen, I'm very undramatic. I'm very scientific. I'm very clinical. I'll say to the wife, I'm looking at your husband's semen analysis. Based on his semen analysis and the fact that you're 38 years old, you've got about a 3% chance of getting pregnant, no matter what you do. So if you want to increase it, let's say to double, to like a 6% chance, your husband needs to get treated. Have a good day. See you next time. And that's it. I'm done. I'm not here to convince anybody or to do anything. I'm here to serve. If you want me to serve you, I will. I will do my best. I will help you. I will use all my 23 years of experience to treat you. But if you don't want it, I'm not going to force you to take it.
Okay. So we've had this.
Can I just jump in there quickly?
Of course, please.
I just wanted to say that's where I think parenting coaching also helps. And I found that it comes in a lot better with the couple coming together. So same thing as Mike, I've often got that where people say, I don't need parenting coaching, I'm not a parent yet. But it's that coming together as husband and wife and deciding that you are now going to be parents. So this is it's a union where you have to work together to create your baby. It's not just in isolation, the woman is the problem. So I think I've seen also a lot of men that come into parenting coaching and they sit with their wives, and the things that come up is real issues like, why don't I want to do that, and deep emotional issues. So that's also where I support the men to actually open up about what their fears are, because those fears also arise, and then they don't want to go to acupuncture, they don't want to do other tests or things that they see as the problem. But thereafter, once they've opened up and discussed it in an open space, I find that they tend to be more open to practices like Mike's.
I love what you're saying. I think it's extremely important and valuable.
Yeah. So it sounds like you're both suggesting that both parents would be expected to attend PTA meetings, and indeed both parents would be expected to be at the birth of their child. So they should take a combined approach to their fertility journey, and that includes practices like yoga and acupuncture and clinic visits and so on.
Yeah, I mean, what people have to remember is that male factor accounts for, depending upon what you read, but the spectrum is male factor accounts for 35 to 50% of infertility. 35 to 50%. So male factor is a huge component in this milieu.
Okay. So Tara, do you have a specific sequence, or you mentioned earlier about the value of building your practice, whether it's yoga or meditation, incrementally. Do you have a set of poses or a sequence that people can practice at home? We obviously still dealing with COVID-19, so people are not necessarily getting into the yoga studio. Are there videos that people can practice at home? And how does one do yoga at home without a teacher to course correct their practice?
So basically, since COVID-19 happened, I've moved my entire practice online as well as in person. So obviously, I'm also based in Johannesburg, South Africa. So I've got patients all over who want to attend classes and obviously cannot come in person. So we do online classes through Zoom. So much like this situation where people come on and everything is live. So it's not a recording that you're watching. It's not something that you're doing by yourself. You've always got me holding you, watching you, seeing what needs to be done for your body. So I don't have a sequence that I do, one sequence for like 20 people, you know, and just change the sequence up. Whether it's in a group or whether it's one-on-one, I factor in what's going on with the people in that class, and I adapt the class for their souls and for their growth, you know, because the way you grow and the way I grow is different. So fertility yoga, I prefer to do one-on-ones because you really get to work in depth with the couple or the mother for that matter. And then for prenatal yoga, we work in group classes as well. And again, it's adaptations to what the moms are experiencing for that day. So I can never plan ahead because I come to a class and I plan, oh, I'm going to do this, this, and the other. And then I've got 3 women who's got pelvic pain, 2 women who's got backache, 1 woman who's tired. So I can't do a standard thing because there's certain things that you can't do with women that have pelvic pain. There's some things that you can't do with women who are, you know, who have lower back pain. So it's literally adapting to who you are and what your journey is at that point.
Okay. Do you think if a patient or a couple could commit to doing 10, 15 minutes a day of yoga practice, do you think that would have an effect on their fertility outcomes?
It can definitely, but I wouldn't say 15 minutes a day. I would rather say at least commit to 3 sessions or 2 sessions a week where it's full sessions with me, with, you know, so you get your full session where you can go and integrate when you're at home. So you can do some of the poses. So I would recommend you can do this if this is how you're feeling. Wake up in the morning and, for example, do this little thing for this reason. You know, again, everyone's different. That you can do every day. But I would say rather commit to 2 or 3 sessions a week and get the full experience of, and it can definitely assist you in your fertility journey, and at least making the journey a little bit more livable.
Yes, that makes sense. Yeah. Mike, we've had another question come in for you. Where do acupuncture needles go for fertility treatment?
So the needles are utilized in the lower abdomen, which is to say, well, I would say it's from the breastplate, from the bone here, the manubrium, all the way down to the top of the pubic bone. So that whole area is ripe for acupuncture, as well as the legs. You can also treat a patient lying face down. You can treat their back and use certain points. So sometimes what I like to do with patients is sometimes treat on the front and sometimes turn them over, the next session, turn them over on the back. So the patient remains with a bra and underwear. They're draped, so everything is private, but I have access to their tummy and to their legs.
Okay. And is that the same for men and women?
Yes.
Okay. We have a lot of patients who come from all over the world to have fertility treatment at HART. So many of them arrive jet-lagged or tired from their long travels. Can acupuncture assist with jet lag?
I haven't the slightest idea. Has nothing to do with my world.
Okay, that's the short answer.
Yeah. I can't answer the question. I can answer any question on this planet about infertility, but I can't answer anything about weight loss or diet or, it's just not what I do. I don't know anything about it.
Okay. What about
yoga can definitely assist.
Excuse me?
Yoga can definitely assist.
It can assist with jet lag.
Yeah, jet lag, tiredness, insomnia. There is a whole range of things that yoga can assist with, and especially even when you're pregnant, you suffer sometimes from insomnia, sometimes from the beginning, and it really does help. We've got postures that specifically help for tiredness, insomnia,
and jet lag.
Yeah.
Okay. Mike, what's the value of having a session after embryo transfer?
Well, actually, the protocol is treating pre and post embryo transfer. So the benefit is the following, that before the transfer is done, you want to stimulate a lot of blood flow to the lining to help enrich and facilitate a healthy lining. What's very important for patients to understand is that the morphology of the lining, the thickness of the lining, does not have any relationship to the quality of the lining. There is a book written by Jacobson Balin. It's a book meant for doctors. I'm going to give you a quote from the book and then I'll interpret it. The quote is, endometrial morphology is not analogous to intraendometrial vascularization. And what that means is endometrial morphology, it's 10 millimeters thick, it's great. It's not analogous to, it's not equal to, it doesn't indicate the vascular function of the lining. Is there enough blood flow in the lining? Is there enough nutrient products in the lining? Are the vessels expanding? Are they opening? You can't tell that just by looking at the lining. I'm sorry, what was your question again? It was about how does it benefit the lining?
Yes, the embryo transfer. Is there benefit to have?
Right. Yeah, sorry. So doing acupuncture pre-transfer is going to greatly stimulate blood flow to the lining to really actually create a healthier lining. Now, what's probably more important is the post-embryo transfer treatment. They're both important, but the post-embryo transfer, in my estimation, is more important. Here's why. This is what the uterus looks like. People think the uterus looks like this. It does not. The uterus looks like two pieces of 8.5 by 11 paper laid on top of each other. In front of the uterus is the vagina, and between the uterus and the vagina is the cervix. And when a patient is having an IVF, the catheter is going through the vagina, through the cervix, in here, to the uterus. As soon as the catheter touches this or touches this, this is what's going to happen. It's called uterine spasming. And do you want to know what? The IVF population has twice the occurrences of ectopic pregnancies than the non-IVF population. Why is that? Because when you do a transfer of an embryo and the uterus is going like this, it can cause retrograde flow of the embryo into a fallopian tube, facilitating an ectopic pregnancy. When you utilize acupuncture post-transfer, it takes this uterus and it goes like this.
Okay.
And so it stops the spasming. As a result of that, you reduce the possibility of an ectopic and thereby increase the possibility of an endometrial implantation.
Okay, that's very interesting. So some of the side effects of fertility medication include bloating or abdominal discomfort from the injections, and also as your follicles grow, there can be some discomfort there. Can yoga and acupuncture assist with some of this discomfort?
Tara, you go ahead.
So definitely it can assist with the pain. Like I said, the stretching assists you getting that out. We have specific postures for bloatedness as well. So when you are bloated, it does help you decrease that. Also, the breathing helps a lot for you to breathe through whatever you're feeling at that point and just allow the pain to decrease.
Okay. How about acupuncture, Mike?
Yeah, so again, this is not really my bag. You know, most of my patients don't come in with a lot of pain, and if they do, they have to go to the hospital because it's an indication of potential severe ovarian hyperstimulation syndrome. Some patients will come in, after a retrieval, and they'll have some pain. So you put some needles in there, and the pain goes away. But it's not really a big part of my practice. And
okay.
It's not usually it's not a frequent event, relatively speaking.
Okay. Just some final questions. How do the fertility specialists that you work with feel about patients doing acupuncture during their fertility treatment? You mentioned earlier in your introduction, Mike, that you work with some endocrinologists.
Yeah, so they're all 100% fine with it. What they're not 100% fine with is the use of herbal medicine, which is a whole different topic, whole different subject, a whole different podcast. But there is some battle that goes on between myself and the reproductive doctor around herbal medicine. But regarding acupuncture, it's a complete non-event. There is no reproductive endocrinologist in the world that would shake their head at it, and if they did, they should leave the business.
Okay. Tara, a final question coming in for you here. I'm very tired and lack energy to continue with my fertility treatment or exercise. Why do I need to practice yoga, and how will it affect my ability to conceive?
So basically the tiredness and not wanting to continue seems like it's an emotional block. That there's something that the lady is feeling, and that's why she's resisting the urge to continue with her fertility treatments. So what yoga and coaching will assist with is finding what that block is, and then seeing what we can do to release that block in terms of moving it out of your body, because our body stores our emotions. Our body stores things in it that we're holding. So those stuck points, those resistance points, sometimes show up in various diseases, or it's not a disease, but a symptom. So like constipation, that tiredness and all of that can also be signs that you are starting to get depressed and starting to feel that depression in terms of this journey, because it hasn't maybe progressed as you thought it would. Maybe you had a certain expectation and that expectation wasn't lived out. So what we do is with movement, we move it out of your body. With breathing, we allow you to get into the emotion of, why am I feeling like this? What's holding me back? And why am I tired all the time? Is it because my energy is somehow blocked? Is it because my emotions are then causing my energy to be blocked? And then through meditation, we just reach heightened levels of awareness where you can then just come and say, maybe after the first meditation session say, you know what, this is what I felt when I went into meditation, and this is what came up for me in terms of why I'm feeling all this resistance to continuing with the fertility treatment.
Great. So it's worth pushing through that tiredness to gain all those benefits.
Yes, and you know what? The thing is, you can say you can push through it without doing yoga, without doing anything else, and you just try and continue, maybe try another fitness program, because sometimes people don't believe in the benefits, you know, like Mike mentioned with his as well. People don't see the benefit in paying a certain amount of money, but understand that this is something that, you know, I study for a living, always to find more better solutions. So if someone comes to me that has something that I've never worked with before, I'll go and read up about it, try and find a solution for you, for your specific journey. So it's really taking the time to just do these things, and you'll see the benefits later. You'll really reap the benefits. So even if you do like the first introductory session, you'll never walk out the same as you walked in.
Great. Mike, any final thoughts from you?
Well, I want to say that I think that utilizing these extracurricular modalities such as acupuncture, herbs, yoga, meditation, eating properly, are all of benefit to the patient. And I think that patients who are suffering with fertility challenges, it's a very, very tough thing that they're going through. And now we're asking them to even do more, which is to meditate, to do yoga, to go for acupuncture, to take herbs. So I say to my patients, you're going to end up with very bloody knees. This is a very arduous, difficult journey. But if you have the emotional, physical, and financial fortitude, there's probably a good outcome waiting for you. Not always, but frequently. So I would implore patients to think about utilizing these other modalities that can potentiate the effect of IUI and IVF. You know, it's a very interesting thing if you look at IVF. What is IVF? It's a strictly mechanical device. You give a patient gonadotropins to stimulate the development of follicles. You retrieve the follicle, fertilize it with the sperm, get an embryo, and transfer it. Big deal. Big deal. You, Tara, and I could learn how to do this procedure in 2 months, 3 months max.
I'm sure the doctors disagree with that.
No, on the contrary. If you met a doctor who was very honest, he or she would agree with me. Because that's exactly what they're doing. Are they doing anything different?
No.
Are they doing anything to improve the egg quality? Are they doing anything to improve the lining quality? Are they doing anything to improve the sperm quality? Are they doing anything to relieve the patient's stress, to get the patient to have their mind, body, and soul coordinated and enhanced? These things are meaningful and important. And so I put to the listening doctors for their consideration to integrate these holistic modalities in their clinics.
I agree wholeheartedly with you. That's part of our ethos at HART, is to treat the patient holistically and not just medically, because a patient who is healthy emotionally and in other areas of their physical health just has better outcomes and responds better to their treatment plan and is more present in the action they need to take to see their treatment through, and to also manage the negative news or negative outcomes that unfortunately happen with fertility treatment.
Absolutely.
Yeah. Tara, any final thoughts from you?
I also just want to stress the importance of
So Kenny,
the
you
emotional
frozen on my screen. Tara, can you hear me?
You also? Yes, I can hear you.
Yes, we can hear you.
You also seem frozen, but we can hear you.
Mike, we'll continue speaking. We can hear you, although your screen is frozen. Tara, go ahead.
Yeah, like I was saying, is I also just encourage people that emotional instabilities really sometimes is the main cause of things not working for you, because your mind fights the process that is happening and it's not integrating into the process to create a union with mind, body, and soul. So as much as it seems like it's something not important to do, and that you're spending a lot of more money on something else or on the actual IVF treatments, and this might not be a priority, I'm encouraging you to try it. You know, even if it is once a week as opposed to maybe 2 or 3 times a week, anything is better than nothing. Mm-hmm. And I'm really passionate about helping mothers as well go through this journey, because it's not easy. As we've said, it's a real journey, and sometimes the journey is longer for some than for others. So I think, you know, it's really very important to just get at that point. And I see the difference in mothers who have high anxiety levels, and they come for yoga and it starts to decrease and they start to be able to live. You know, we are trying to have a baby, we're trying to conceive, but you don't need to stop living when you're doing that. When you're a parent, you don't need to stop living to be a parent. And after baby, your life doesn't end, you know. So really, I'm encouraging emotional awareness. For me, is the utmost importance.
Yeah, that's beautiful. Well, that's all we have time for today. There'll be a recording of this conversation on our socials. Tara, Mike, tell everyone how to find you.
So I'm Mike Berkley, and my website is berkleycenter.com. That's BERKLEY center.com. And of course, you can feel free to call me at 212-685-0985, and I'm happy to take and answer all and any questions. And good luck on your journey, people.
Tara?
You can get me at www.yogamama.co.za, but also you can contact me through HART Fertility Center, as I am the Associate Yoga Fertility Expert on their side. So if you just email info@HART Fertility, you should be able to get a hold of me. I've also got a voucher on the newsletter where you get a free hour session for HART Fertility Center's patients. So just contact them on the email address and then they'll direct all of you to me.
Yeah. Of course, we'll have both your details on when we share this video, so people will be able to get a hold of you that way. Thank you both very much for joining us, and you've shared some amazing information with us. I hope you'll be able to come back soon. For those of you watching, thank you for coming on to join this conversation. You can find us at heartfertilitycapetown.co.za, and you can visit us on our Instagram page and Facebook, and wherever else you can search for us. A good evening to everyone, and stay safe.
Thank you. Nice meeting you both, and this was lovely. Have a great evening. Thank you.
You too. Bye.
Bye.